Continence is confidence, expert guide to tackle incontinence confidently.
Hello, I am Dr. Shreyas Bhalerao. I am a consultant urologist practicing at Panchkula. Today we will be talking about incontinence. Now, first of all, what is incontinence? Incontinence is nothing but leakage of urine involuntarily. So, incontinence could be of different types. It could be urge incontinence, it could be overflow incontinence, it could be total incontinence, or it could be a mixed incontinence. So, one by one, we will discuss each type of incontinence. Now, starting with stress incontinence. Stress incontinence is something in which a patient passes urine or there is leakage of urine with increase of abdominal pressure. Now, that will happen because of any cough or while doing any strenuous exercise or any strenuous work. Due to these activities, the pressure in the abdomen increases, and that pressure in turn increases the bladder pressure, and there is leakage of urine. Secondly, we'll talk about urge incontinence. Urge incontinence is nothing but incontinence associated with urgency. Some people, they have a symptom of frequent or sudden urge of urination, which they cannot control or which they cannot avoid. In those patients, sometimes they cannot control that urge and it leads to incontinence or leakage of urine. The third is overflow incontinence. Overflow incontinence is sometimes associated with underactive bladder. In overflow incontinence, the patient doesn't realize that the bladder is full. It mostly because of the decreased sensations of the bladder. The patient doesn't realize, and since the patient has not realized, there is exceed in the quantity of urine within the bladder, and that leads to sudden leakage of urine. This is called as overflow incontinence. Now, the fourth one is the mixed incontinence. In mixed incontinence, you may have 2 or 3 types simultaneously. The most common type of mixed incontinence which we get is a combination of stress incontinence associated with urge incontinence. Now, it is very difficult first to identify or to diagnose the type of incontinence because the treatment of different types of incontinence varies. In stress incontinence, basically stress incontinence happens because of the weakness of the pelvic floor muscles or the supporting muscles, which leads to incontinence. In this type of incontinence, we have to strengthen those muscles. And if exercise is not sufficient or not enough, then we have to go for a surgery to strengthen those muscles. For each urge incontinence, you have to decrease the urgency. Now, urgency, it happens because of overactivity in the bladder. So, by medicines, you have to decrease the amount of overactivity, which could prevent that urge and in turn the incontinence. For overflow incontinence, sometimes you have to, it is very difficult to treat because, as I've told you, it could be because of loss of sensations of the bladder, and mainly it is associated with a neurogenic bladder. So some medications may help, but otherwise it is important to keep the bladder empty time and again, either voluntarily or by placing a catheter through the urethra. Now, the mixed type of incontinence has to be identified. The components of mixed incontinence has to be identified, and they has to be treated independently. So this is how mixed incontinence bothers the patient, and this is how we diagnose and we treat it. So I hope this video or this message has been helpful to you. And if you have this kind of incontinence or symptoms, it's always better to go and visit a nearest urologist as early as possible so as to prevent your bothersome symptoms. Thank you.